Raina, I want to turn to you now on this the second abstract that really was looking at the use of these bone pain surveys and pain surveys in general to really assess the response of pain to lutetium-177 PSMA from the VISION study, and there was a nice abstract on that. Do you want to give us your takeaways in terms of its palliative benefits as well?
Yeah, absolutely. So I think, thinking about where these patients were along their disease course, these are pretty refractory patients, as we already heard with regards to the eligibility criteria. They've received prior taxanes, they've received AR inhibition, they were randomized to lutetium with standard of care versus just a standard of care alone. And that standard of care really varied from the majority of patients were getting next generation AR targeted therapy, but also steroids or SBRT, metastasis-directed therapy, so other palliative things that we may utilize in end-stage CRPC. I think quality of life assessments can sometimes be, not to say difficult, but there's an art to it. And, how you roll the quality of life surveys, which surveys you choose to do, the time points that you complete the surveys, who's actually completing the surveys. The particular endpoint that was looked at here was time to deterioration of, symptoms, which was prolonged in patients receiving lutetium compared to just the standard of care arm. And you would kind of hypothesize that is what you would see, because this is an effective life-prolonging therapy, and patients stayed on therapy longer. And you would kind of hypothesize that yes, we would delay the time to deterioration of symptoms. And I think more data is needed regarding looking at, are we actually making patients feel better, and how dramatically are we doing that? And, the other thing about quality of life is, while things can be statistically significant, I think we need to understand, well, is that clinically meaningful? What does it mean to have a, X grade change on a certain scale? Like how does that translate into what a patient may feel? And then, like, again, who's completing these surveys? Like, if there's dropout towards the tail end of, people being on therapy, then you're not capturing that data. And generally it's the people that are not feeling well that are not completing the survey. So I think we have to interpret these kinds of things with caution. But I think as we move the field forward, I think actually coming up with, consensus guidelines around how to implement quality of life measures in the context of phase 3 trials and developing that in a very systematic manner would probably be ideal, I think, for the field as a whole.
Well, I can't thank you all enough for this really interesting, I think, inspiring discussion around lutetium-177 PSMA and the potential rollout of this in the near future, and what implications we have for this year and things to look forward to in the years to come. Thank you all for joining, and on behalf of my roundtable colleagues, thank you all for listening today.